Hello, everyone. My name is Luis Perez, and I'm the President and CEO of Mental Health Connecticut. Joining me today is Ben Gammell, Director of Exhibitions for the Connecticut Historical Society. And today is a special day for Mental Health Connecticut. Besides celebrating Mental Health Month this month, we are also celebrating Founders Day today. Today was the day that Clifford Beers founded the Connecticut Society for Mental Hygiene, as a result of his experiences with the mental health system at the turn of the century. So here we are, 113 years have gone by, and we continue to honor Clifford's legacy. So Ben, I know that the Historical Society has been working on an exhibition that will come up this fall on mental health in Connecticut. So I thought it would be really, it's really apropos, right, that you're joining me today, and we can talk a little bit about some of the things you have found and tell us about what people can expect in the fall.
Yes, sure. Thank you so much for having me. This is it's a great opportunity to share the project that we're working on and you know, get folks interested and excited about delving into the topic. So we do have a new exhibition. It's opening in November 12th of this year. And the title of the exhibition is Common Struggle, Individual Experience, an exhibition about mental health. And this has been an idea we've been thinking about for several years now. There are several anniversaries coming up and being recognized. For example, the Hartford Retreat for the Insane, which is now the Institute of Living, was founded in 1822. So their 200th is coming up, and so this topic has been in our consciousness, and we thought this, as the Connecticut Historical Society, we had a very unique position where we could look into our collection and see what we have that can bring out stories of people who have struggled with mental health throughout history. So what we're putting together, it's maybe a little bit different than what people might expect at a history museum, because we are presenting historical events and stories from the past, but we really want to connect it to people's experiences today, struggling with mental health, talking about mental health. And so we have also, in addition to doing historical research and looking into our collection, we've been interviewing people in Connecticut throughout the state. So we are featuring their perspectives, their personal stories, their experiences in dealing with mental health conditions and finding treatment and achieving victories or dealing with some really painful things. And so that's an exciting part of this exhibit. Is it's very contemporary, and we hope that this exhibition will reflect what we're calling our big idea, which is kind of the theme that guides us as we develop the exhibition, and that is understanding how people have struggled with mental health throughout history will help us support ourselves and each other today. That's kind of our big goal for this exhibition.
That's excellent, and what a great approach, right? Because if we don't make it relevant to today, and have it be something that people can actually it resonates for them, right?
Right.
And knowing that they're not alone, that others have come before them and dealt with. It gets to the condition of being human, right? And it's that humanity that we want to tap into people. And throughout history, and certainly in Connecticut's history, Connecticut has a very rich history in terms of its mental health services, and sometimes some things that we only knew what we knew at the time. So sometimes treatments that today we would think were barbaric and in essence were. Can you tell us a little bit about some of the aha moments or surprises that perhaps you encountered as you were doing your research?
Yeah, what we decided as we were developing this exhibition, and we've consulted with a lot of different people throughout the planning process. We've had focus groups from the community to see what they thought was important about mental health or what they wanted to learn. And we decided we really wanted to focus on some of those personal experiences, you know, and that can be challenging looking through the historical record. You know, it's not easy today necessarily to talk about your personal mental health. And, you know, that's been similar throughout history. And so when we try to find people's records, their personal experiences, that can be challenging. But we found some interesting things. You know, I can give you a couple of examples. I mean, there's a woman whose name is Faith Trumbull Huntington, and she was the daughter of the Governor Jonathan Trumbull during the Revolutionary War. And we have needlework that she made in our collection. She was an artist, but she struggled with mental health. She died by suicide in the late 1700s. And we have letters that are written between family members. We don't have her personal experience, but we have the very raw emotional letters between family members who are trying to care for her. And you know, they sort of see what she's dealing with and they want to help, and they're trying to find help. So it's a very moving story from kind of an indirect angle, looking at it through the eyes of her husband and her parents as they write about her. So I thought that was it's a very moving story and an example of, you know, mental health affects everybody, whether you are dealing with it yourself or you're caring for someone. You know, we all have some connection to different mental health struggles, I think. So that was one powerful story of quite a few that we found.
Yeah, and I think it's so symbolic of the fact that mental health strikes everyone, right? Whether you're the daughter of a governor,
Right.
Or you know, just a simple person. There's no discrimination. What does get discriminated is our people, right? Who perhaps, you know, through their mental health condition, lose their privilege, if you will. Certainly that was Clifford Beer's experience, right? A prominent Yale graduate from Greenwich who was working in Wall Street, and as he was diagnosed with what we know today as bipolar, manic depressive disorder, he found himself losing his privilege, and that's what prompted him to start the advocacy movement. So here we are, right? A century later, if not longer, and we're still dealing with issues of stigma, right? Families that don't want to, and individuals that feel like they could not be out in the open, and any other examples of that or any examples of people like Clifford, who said enough is enough. I'm going to, you know, come out of the mental health closet, if you will, and tell my story.
You know, I can give you a couple of examples. One is an individual. He was a Civil War soldier, and he wrote a book in 1867 called Life and Death in Rebel Prisons. And he was a prisoner of war, and he really, you know, the description of the treatment of soldiers and the mental toll that it took is very vivid in his book. We have other letters from another soldier in the Civil War. His name is Joseph Orrin Cross. He was a member of the African American 29th Regiment. And, you know, here's an example of where we kind of have to read between the lines. He's writing home about just the awful experiences of war. And from our perspective today, we can imagine what kind of mental health toll that can take on someone. He doesn't say that specifically or explicitly, but he also, you know, he talks about those experiences. And then there are also records in our collection of these soldiers getting back together for reunions and talking about the support that they found in reuniting with their fellow soldiers and how that's healing. So as we look at the past, as we're developing this exhibit, we try not to assume too much, or certainly we don't try to diagnose people, but you can make some assumptions that, clearly these are examples of events that affect someone's mental health, and how do they deal with that, and how do they find healing or some sort of treatment. So there are examples of that. There's some pretty painful, ugly examples too. I mentioned Faith Trumbull Huntington. She's, as we mentioned, she's from a wealthy family. She's sort of in the upper levels of society, and her family did have resources to find help. We have we have some examples that we have one individual who was African American and was very poor. And there's a doctor writing a letter about him, and the doctor talks about treatment. Well, the treatment is pretty abusive and horrific, and we don't know a lot. There's mysteries in these documents because we don't know the whole story. We don't get the perspective of the person who is being quote unquote treated. We get the perspective of the doctor who is describing some pretty horrific things, chaining someone up and making them work in the field. So there are some inspiring stories and also some pretty tough examples that we have found in our collection.
Yeah, and it is essential that we don't forget where again people have been, because it kind of sounds like we haven't made a lot of strides, even though we have. We're still dealing with health inequities in the country, and certainly around access to behavioral health, mental health, substance use treatment, as well as, again, that the stigma and the discrimination that still goes on, which is what makes Mental Health Awareness Month that much more important, because we want to make sure that everybody understands that we're all susceptible as human beings to having either mood changes and what we call sometimes the little MH. Not to be pejorative, but as opposed to the big MH. And certainly the last year of pandemic has brought to the forefront that again, you don't need to have a diagnosis to be feeling. So I could talk to you all day, and hopefully we can get together again and have some more conversations as your exhibit opens in later in the fall. So I hope you're open to that.
I would love that.
Awesome. And again, thank you, and thank you to the Connecticut Historical Society for bringing this very important issue to the forefront. And to our listeners, please take advantage of all of our tools to thrive at mhconn.org, and wishing you good mental health. Thank you for joining us.
Thanks.